Hey everyone, Dr. Mark here with Max Living. Today I want to talk to you about the most important bone in your entire body. So you have over 200 bones in the body, but one bone trumps them all. So I want to show you that with this cervical x-ray right here. So this is an x-ray of the neck, and this guy is facing this way. So you have the jaw in the front, here's the back of the skull, and these are the bones of his cervical spine. The top bone here is called the C1 vertebra, also known as the atlas. The atlas is the most important bone in the body. Why is that? Well, the brain sits up here in the skull, but an extension of the brain called the brain stem sits right here. The brain stem, everyone's heard of that because it's so important. There's so many vital functions that come from the brain stem. And your atlas protects your brain stem. In order for it to protect it, it needs to be at this angle right here. Taking off like an airplane. I like to say you don't want it to be flat like this. You want the angle to be up this way, with enough space in between here for blood flow and nutrients to get to your brainstem. So let's say the atlas bone is misaligned and it's compressing the nerves right here, which go back into your head. The symptoms that that person would have obviously would be headaches. A lot of times it's migraine type headaches. They'll have sinus pressure or allergies, even vision or hearing problems, mood, anxiety, sleep difficulties, all the way to hormone problems, and even balance and coordination, which is all controlled in through here, not so much up here. So we check this complex very specifically, we measure it, and we do corrective adjustments to free up that nerve flow that's going down from the brain through that area to the rest of the body. And so even a small misalignment can make such a big difference when it's up at the top of the neck. So if you remember Christopher Reeves, who was Superman in the movies, he fell off that horse and he jammed the top bone into his brainstem and only dented his brainstem about 8 millimeters, which means you could cover it up with your pinky finger on the x-ray, the damage that occurred. However, his whole body shut down. So his arms and legs wouldn't work anymore. He was quadriplegic, but also his heart shut down. They had to put a pacemaker on his heart. His lungs wouldn't breathe anymore. His stomach wouldn't digest, so they had to tube feed him, and then a nurse had to push and squeeze the food through his colon into a colostomy bag because he couldn't have his own bowel movements. But if you think about it, did he have bad intestines? No. Was his heart bad or his lungs? Not really. It was what? It was his nervous system that was disconnected. And the problem wasn't in his lower back, which controls digestion, and it wasn't in the lower neck, which controls the heart and the lungs. It was all the way up at the top here. But because it was at the top, it affected everything down. So we get people with lower back pain and they come in and they say, check out my lower back. We look at their lower back and the x-ray looks fine. The pelvis is even and everything. We look at their neck and it's a total mess. When we get the neck fixed, what can happen with their lower back pain? Obviously, it can get better because we're not just dealing with individual nerves and individual segments only. The entire spine works as a unit, so we correct the spine all together. Hope this video was helpful for you. Hope you enjoyed it, and we'll see you again next time.